Government.
Well, good morning. Another CIA Certifiably Insane America report with Michael Eichbar reporting. Well, today I called John McCain's office and I called Fox News. And here's the number for Fox News. It's area code 212-301-3000. And I gave this as a story idea, what I'm saying here right now, to both of them. We don't need government to control healthcare. Now, we can have a very simple system put together initially that is not where there's no co-op made of the people, but made of the physicians themselves. And that co-op is a physicians pool that will turn into maybe a physicians insurance company in the right amount of time. Now, how does this work? I've said this in my previous report. You're all fired with the thumbnail of Donald Trump, but we'll repeat it again here. When you see your physician, the physician of your choice, whether you're on Medicaid, Medicare, a separate insurance company, you still have to pay an initial fee of 5% of your monthly income. Now, at the high end, that can be a substantial amount. At the low end, like someone that makes $1,000 a month, that would be $50 for an initial visit, and then it's divided in a single month. If you have follow-up visits for an initial visit to a doctor at $50, it would then be the next time $25, the next time $12.50, the next time $6.25. And that total would be all that the doctor can get from you that month. But the next month, if he needs to see you again, it starts at 5% again. You have to start at 50 again, paying the doctor 50, and down by halfway increment for all the times that you see the doctor. You get this idea? See where the money's coming into the doctor? We're actually paying the doctor, something we don't do anymore. Now, if everybody who has insurance or is on Medicaid or Medicare pays that initial 5% fee, the physicians can then have a physician's pool where at least half to three-quarters of that money, they can pocket a quarter, but half to three-quarters of that money goes into a physician's pool. Now, at the high end, that could be a substantial amount. Somebody who's got a lot of money might be paying $500, If they're making 10 times $1,000, they're making $10,000, they might be paying $500 the initial visit. If they make $100,000, it could be $5,000. But it's still it's even, it's equal. Everybody's paying 5%. All right, on their initial physician's visit. Now, that money is very important. It's not just the physician's money. It's not money coming from the insurance. It's coming from people that are already ill. And that money being in the physician's pool can be redirected, let's say, through the AMA and medical directors in that physician's pool to open a physician's co-op that you could even buy into for your own physician's co-op insurance. No government. Your FICA is paying for your Medicare if that's what you're on, right? And you're paying your private insurance companies if that's what you're on. And in time, as the physician's pool builds up, and they can institute their own insurance company, physician's insurance, that you would also pay into if you want that insurance. Then we have an independent, non-government controlled medical system that will cover the indigent and those that are not insured. All right? But they have to pay that 5% even if you're uninsured. If you're not, you're obligated to the 5% at the lowest end, which would be the Medicare that you might have gotten monthly. If you get, it would be like if you had no coverage for being handicapped, but you've worked in your life and you paid so much FICA into a system, well, then you'd be allowed so much money in a month. Now, what you would have gotten in that month is what you'd really owe the physician, and if you're indigent, you can't pay it. Maybe you could go out and collect bottles. Do something. This is America. You can do something to pay your doctor with. Anyhow, in time, that would disappear. I think everybody would end up being covered through either the physicians, the physician-created co-op insurance that was really out of the physician's pool, that is instituted through a 5% payment of their patients as a co-pay to all their insurance policies. And if everybody in America, when they saw their physician, actually did something we don't do anymore, pay their physician 5% maximum in a month of your monthly income, which anybody that's working can afford, and that's equal for all, then we don't need government in our health care. We don't need government directing it. It becomes physician directed. And isn't that what we all want? Being able to talk to our physician, go to the physician of our choice, and have physicians direct whether you need that care or not some government bureaucrat. This is Michael I. Squire, Certifiably Insane America reporting, and if you think this is a good idea, call Fox News. Area code 212-301-3000. Let them know. Let them come to my little site here and look at it. And I'll explain it to them as I've explained it to you just from this YouTube. Have a nice day. This has been your CIA report, Michael Squire reporting.